Hello there, and thank you for watching this video about joining the CUE community in the North East and North Cumbria, a national initiative being piloted at the regional level. During this presentation, I'm going to give you a quick overview about what CUE is, provide some background to the initiative, explain why you should join CUE, and give you information about how you can join the CUE community. First, let me tell you a bit about the Health Foundation. Perhaps many of you are familiar with or have worked with the Health Foundation. The Health Foundation is an independent charity operating across the UK. Their aim is a healthier population supported by high-quality healthcare that can be equitably accessed. They learn what works to make people's lives healthier and improve the healthcare system. From giving grants to those working at the front line to carrying out research and policy analysis, they shine a light on how to make successful change happen. The idea for CUE came from the Berwick Report in 2013, which stated that the NHS should become a system devoted to continual learning and improvement of patient care. NHS England aimed to recruit 5,000 safety fellows and approached the Health Foundation to design and host the CUE initiative. They started a process of substantial engagement on what the initiative should look like. Through this engagement, the scope of the work was extended beyond patient safety to the whole of the UK and beyond the NHS to health and social care. The approach was to ensure that CUE was delivered bottom-up rather than top-down, so it was decided to co-design this initiative with those who would be part of it. Over 300 people were consulted and a founding cohort of 231 people was recruited or nominated from various improvement organisations across the UK. This founding cohort was made of a diverse range of people. In fact, it is arguably one of the largest co-design processes undertaken in healthcare in the UK. Since CUE is an experimental learning process, to aid this learning, RAND Europe has been commissioned to provide developmental evaluation processes. So what is CUE? Well, in summary, the overall aim is to connect people with the expertise or experience in improvement to accelerate the spread of learning and capacity building. This initiative is not primarily about training more people, but rather recognising and connecting those who have developed expertise through many different routes. We hope that CUE makes it easier for people to share ideas and skills, enabling changes that bring improvements to healthcare. CUE is led by the Health Foundation and supported and co-funded by NHS Improvement. There is no membership fee and no time commitment associated with CUE. It is really important to emphasise that CUE is designed to complement other work or initiatives as described in this slide. You might have many connections and networks of value to you on a particular area, geography or specialist project. CUE will make it easier to find out who is skilled in improvement in a particular area. It will help build the capacity of people leading improvement, make it easier to find and work with others on shared challenges, and seeks to build a more supportive environment for improvement. CUE will help you to build on these connections in ways which suit you. One of the key design principles for CUE has been to complement rather than compete with other networks and initiatives. We certainly don't want CUE to be something else that people feel obligated to. The value of being a CUE member includes to join a home to turn to with a diverse range of improvers, to raise the profile of improvers and your work. You'll gain access to online resources and be offered opportunities for sharing ideas, enhancing skills and collaborating on improvement projects. You'll be able to continue to help shape the long-term initiative and have the opportunity to give back to the improvement community. Being part of the CUE community offers you the opportunity to take ideas and learning back to your workplace, spreading and sharing your learning beyond CUE, the chance to build your relationships and networks, the chance to contribute to the community where possible, attending events, engaging with the newsletter and future online platform, as well as social media. You'll be part of a polite, respectful community where there is constructive challenge and feedback. There are no membership fees and no time commitment. In order to become a CUE member, you need to fill out an online application form. This application window is open from Thursday the 3rd of November until Monday the 5th of December 2016. More information can be found at the Academic Health Science Network North East and North Cumbria website. Here you can find documents such as Is It For Me?, a decision guide to help you decide whether or not to apply for CUE, as well as the application guidance an FAQ document, and other relevant information about Q. To complete your application, you will need to register at the AIMS website, shown here at the bottom of the screen. In this application, you will be asked to reflect on your criteria about your knowledge and experience of improvement and how you can benefit and contribute to the Q community. The online application form will request information about you, about your work, about your organisation, and about your commitment, knowledge and experience, as well as a declaration and marketing section. After you've submitted your application, this will be assessed by 2 reviewers. You will then be notified by email of the outcome. If successful, you will be invited to join a Q welcome event. If unsuccessful, you will receive feedback on your application. If you wish to join the Q initiative and become a Q member, then please visit the Academic Health Science Network North East and North Cumbria website, shown here at the top of the screen. Applications open on Thursday the 3rd of November and close on Monday the 5th of December 2016. You'll be notified of the outcome of your application week commencing Monday the 6th of February 2017. If you would like further information, please feel free to join us on our teleconference calls on the 9th and the 16th of November at 12 p.m. using the dial-in information shown on the screen. If you would like more information, or you think you are not ready for Q yet but would like to be part of the regional patient safety and quality improvement community, then please email Andrea Cavaco at the Health Science Network on the email address shown below. Thank you for listening.